Hi there, and welcome to A&P with Dr. O. In this video, we're going to go ahead and take a look at some of the structures that are associated with the heart. Right now, we're looking at the heart in an anterior view. We can see the upper chambers of the heart. So we have our right atrium here and our left atrium here. Plural would be atria, but singular, if we're just looking at each one by itself, then we use atrium. Left atrium, right atrium. There's an ear-like flap or appendage on the atria. This is known as the auricle. And then we can see the lower chambers of the heart, the ventricles. We have the left ventricle and we have the right ventricle here. And then the heart is going to end in this pointed tip that is known as the apex. We can see some of the major vessels associated with the heart. We can see the superior vena cava here. We can see the aorta. We have the ascending aorta, the aortic arch, and then going down we have the descending aorta. We can also see the pulmonary trunk, which is going to branch into the right and left pulmonary arteries. This would be the left pulmonary artery. We can also see below that the pulmonary veins. We can also see the indentation that marks the border between the atria and the ventricles, and that indentation is known as the coronary sulcus. We also have an indentation or groove that is going to mark the border between the right ventricle and the left ventricle, and then that groove filled with fat. We can see the adipose there and these vessels. That is going to be the interventricular sulcus. And we can see the anterior interventricular artery. And then over here, we can see the great cardiac vein. We can also see the ligamentum arteriosum. In the fetal heart, that is the ductus arteriosus. And when the baby is born, the ductus arteriosus becomes this ligamentum arteriosum. We noted the superior vena cava a moment ago. If I turn the model, then we'll be able to see the inferior. I've turned the model. We can still see that superior vena cava. Here's the right pulmonary artery. Here are the right pulmonary veins. And then here is the inferior vena cava.